Good afternoon. This is Heather Allen from Department of Health with the Health Home Program. I'm here also with Megan Luce from Department of Health. We're really happy that everyone is here today for this CANS New York Lunch and Learn on rating multiple caregivers. We just want to make sure before we get started that everyone can see the screen and also hear us. So if you could just type in the questions box, if you can see the screen and hear us, that would be great. Great. So we'll do another test to make sure that everyone can hear Josh. Today we have Josh Nellis doing the presentation on rating multiple caregivers. He's the manager of organization development and learning at Hillside Family of Agencies, and he's also the Western Regional Lead for the CANS New York Technical Assistance Institute. So we're really happy that he's joined us today to do this presentation. There will be 2 breaks during the presentation that will allow people to ask questions. So in order to do that, you can type your questions within the question box and also raise your hand for discussion. So without further ado, I'd like to welcome Josh to the presentation.
All right, hello everybody. Thank you for that intro, Heather. As mentioned, my name is Josh Nellis, and she gave a great intro of who I am and kind of what I represent. I am one of the regional leads for the CANS New York Technical Assistance Institute. I will talk a bit more about what the Institute is and how we can support you guys at the very end, including I'll have some contact information I'll put up on the screen for myself, the other regional leads, and the leadership of our Institute. I will just to let you know, if people have been putting things in the chat box, I see none of it. I'm not sure why, but I don't see any comments at all, so I will need help with the questions being read off when we get to that section. So as mentioned, this is a lunch and learn. This is an idea that we came up with as an institute and are hopeful that it will be a good format in which to kind of focus in on some narrow topics with regard to the CANS, help answer some of the questions that you may have about some of the nuances around the CANS. So for today, we selected this topic, which has come up as a question to a lot of us as leads, as well as many of the coaches in our institute. We've kind of received versions of these questions from a lot of different sources around, care managers maybe not quite understanding which caregivers they should rate, how they should determine which caregivers they're going to rate, and then even more specifically thinking about foster parents, thinking about congregate care or residential care settings, and sort of what are the nuances and the ways in which to determine who gets rated as caregiver in those scenarios. So that's what we're going to kind of focus in on today. I have some stuff prepared that I'm of course going to talk about, but my hope is that this will be a discussion and a conversation. So you have the ability to press that raise your hand button to let us know that you'd like to speak to us, and you of course have the ability to enter your questions into the chat box. We're hopeful this will be a good format, and we hope that you guys will also, through a survey that's going to come out at the end, actually give us some topics for future lunch and learns. If you like the format, you can kind of give us some feedback on that, and then give us some more topics to dig into in the future that either I or my other colleagues in the Institute can have a chance to speak to you about. So without further ado, we're going to talk a little bit about multiple caregivers and thinking about how do we rate the various different caregivers in the lives of our children within the context of our health home system. So we want to start thinking a bit about just what do multiple caregivers actually mean? What are some of the mechanics that we're talking about here? So on your screen, you'll see just some of the many, many different scenarios that we might be considering for the children that we serve. Of course, multiple live-at-home parents is an obvious one. We want to be thinking about children who have shared custody between parents. We're thinking about parents who live at home, but also those who may have visitation rights. So maybe not a full shared custody situation, but a visitation rights situation. Single parents, and also thinking about the significant other who may live at home, who may not be a biological parent, but may certainly be a caregiver who has an important impact upon the children that we're serving. We're going to talk a lot today in the second half of this about foster care and all the different scenarios. You can see them there, and I'll dig into those deeper a little bit later when we think about which caregivers we want to be considering with all the different types of foster care scenarios we might run into. We also want to consider kinship fosters, which are children living with a biological family member, maybe grandparents, aunts, uncles, even siblings who may have caregiver roles in a kinship foster kind of a scenario. We want to be thinking about children in adoption scenarios, post-adoption, I didn't write it there, but certainly pre-adoptive scenarios as well. And there are, of course, many, many others that I didn't get to here, but I'm sure you will experience or have experienced in your careers. The reason we consider all this, the reason we think about all this is we really understand that caregivers are critical and influential as a component of the health and development of children at all ages. We cannot really consider children without considering their caregivers. The caregivers can have impacts upon every domain of a child's life, and they can have those impacts in any number of directions, either supporting and helping to resolve and overcome needs. It can also present needs that present challenges for the children that we're serving and the children that they are caring for. So we recognize that we cannot really consider the child without also considering the caregivers. They're a contextual variable. They really help us determine how the children will progress through care, but more importantly, how the children will progress through their childhood and into their adulthood. We also want to recognize that unique to health homes, the caregivers play an important role in the acuity determinations, that they are a part of the algorithm. We're not going to dig deep into the algorithm at all today. That's not what this presentation is about, but we do want to recognize that understanding who the caregivers are and rating them appropriately is a critical component in those decisions that the algorithm is making being made effectively. So we want to start by thinking about who are the caregivers for any of the children that we serve. And I think it's really helpful to start with the simplest comment that we can make, which is ask the caregivers, ask the child. The CANS is a communometric tool. It is meant to be a result of assessments being done by all of the people who know and care about and are supporting the child that we are serving. And so that, of course, starts with their caregivers, and that, of course, starts with that child themselves. So it's always a good place to start by asking. You'll generally have a caregiver identified to you as a child comes into care for the first time, and that will be the great person to start with to obviously introduce yourself and speak to them, but also ask them, who are the other caregivers in this child's life? Is it just you, or are there others? Help me understand that. And of course, asking the child is going to be a real effective way to start determining who the caregivers that we want to rate are. And that can be really important in scenarios where maybe the child is identifying a parent who may no longer have custody or has shared custody or maybe only has visitation rights, and for whatever reason the first caregiver you spoke to doesn't want to acknowledge that other adult as being a caregiver. But when we talk to the child, they speak to us about just how important that other caregiver is. So those two caregivers may themselves not have a great relationship with each other and may not even want to acknowledge that the other is a caregiver, but the child is making very clear to us that both of them are playing that role in his or her life. And so this is a really great starting point for us to think about who are all of the caregivers who are having that impact upon the child and can impact what that child's progress through their life is going to be. And that brings up the good point, and this is true throughout the CANS and really throughout the whole kind of philosophy that the CANS is built on, this TCOM philosophy, that not everyone is going to agree about everything. Consensus doesn't always mean everyone agrees on every single point. And so there may be points of contention between caregivers about who the other caregivers may be. And one of your jobs, one of the reasons that you're in this role, is to navigate those conversations and to help caregivers, whomever they may be, understand the importance of you putting together a complete and full picture of this child's life by including all of those adults who may be playing that role in that child's life. We can also ask other professionals. It's not written here, but it certainly is important to us. Again, your role as care managers, and really the role of this CANS tool in general, is to bring in, to be communometric, to bring in the thoughts and understandings about this child and family from everyone who has an understanding of this child and family. And in many cases, that means former care managers or HCIs or waiver ICCs or who, whatever their title may have been, folks that know the family and understand the nuances of this particular family unit, school staff, former service providers or current service providers for those kids that may be coming from those 19 to 15C programs, medical supports, behavioral health supports, therapeutic supports, anybody who knows the family and can give you more insight as you are kind of getting yourself up to speed on who this family is. Talk to those people, get an understanding of who the caregivers are, and really try to know everyone who's involved in the child's life playing that role. And that can include shared custody situations, as I mentioned. That can include grandparents, aunts, uncles, caregivers. There may be scenarios where a child is temporarily living with a family member, and those scenarios could be because a parent spends a lot of time working out of town. Maybe they travel a lot for their in their life. Could be the parent is involved in the military. Maybe they're deployed for a short time, and so the children are staying with grandparents or an aunt and uncle or whomever. We always want to be considering who are the people that are providing care for these children in our current time. We, of course, have some text that really dives into this, and this is straight from the CANS manual. The majority of you, I see 193 attendees right now, and I would guess that the vast majority of you are CANS certified currently, so you have looked through and been trained in this manual. So you should have a sense of understanding about what it is that really we are saying. And ultimately, I'm not going to read this verbatim. You can do that yourself. But the key takeaway here is we rate everybody. We rate anyone who is playing that caregiver role. So you see it kind of clearly about halfway down. It can be parent substitutes, right? Which can be all those folks that I've mentioned already. Can definitely be foster parents, which I'm going to dive into much deeper a little bit later. It can be a biological parent who doesn't live with the child. You don't necessarily have to live with a child to be a caregiver in their life. And again, every family is going to be different in how they describe this, which is why I encourage you to think about asking the caregivers, asking the child right off the bat, because the families of the children you serve may not always look like the families you grew up in or that you are currently raising. And so different scenarios, and part of us being culturally humble and really understanding the cultural differences between families is allowing the families to show us who they consider the caregivers to be. What also becomes really important here too is to think about, we don't want to determine which caregivers we're going to rate simply based on what the ratings might be. I know I've talked to folks and tried to kind of change their mind around, well, I'm not going to rate so-and-so because they would just be all zeros. I've heard that said to me by folks before. And we really want to encourage you to not look at it in terms of what their strengths or needs may be. Are they a caregiver? Yes or no, that should really be our determiner of who we're going to rate. And the reason that's important is things change over time, right? These ratings are based upon context, and context changes. At minimum, you are completing a new CANS for Health Homes children every 6 months, and things will change, and that includes the needs and the strengths of the adults in their lives. That parent may be all zeros today, and that's great, and that's a really great thing for the child we're serving, but things can change a lot in 6 months. There are items on there related to medical health. There are items on there related to substance use and abuse. There are items on there, every single item on there can change over time. People can develop needs that they didn't have before. People can resolve needs that they didn't or that they did have before. So we want to get a baseline. We want to start understanding who the caregivers are and what their strengths and needs are for a child, and then be able to recognize those changes over time, because that's going to change our interventions. That's going to change what we're able to do to support these families to make healthy transformations and move on with their lives. So it becomes really critical. We also also want to really be thinking about why do we rate everybody? It's because each caregiver impacts a child in different ways. I'm a parent of 2 children. I co-parent with a spouse. We each have very different impacts upon our children, and there are skills that I have that make me very effective in certain ways, and there are also deficiencies in my parenting that have sometimes what I would consider to be negative consequences on my children. And my wife, the same thing. So there are scenarios where my strengths help to offset some of her needs and vice versa. And there are areas where our joint strengths can have, an even stronger impact on our kid. And yes, areas where our joint needs, need to kind of be overcome as a team in working with our children. So we want to recognize that different caregivers within a caregiver team each can have their own impact upon the kid. This becomes really important too in thinking about really wanting to encourage you not to rate caregivers as a unit. So when there are 2, kind of parents, be that in a traditional 2-parent household or any other scenario where there's co-parenting going on, we really want to be thinking about rating each individual, and for just those reasons I just discussed. For those of you that have been longtime CANS users, you are probably familiar with a lot of our training vignettes that have typically asked you to rate sort of a caregiver, a co-parenting unit on that assessment. We're getting away from that. We're in the process right now of kind of going through and revising a lot of those vignettes that you see on the training's website, and we're getting away from asking you to rate caregivers as a unit and instead sort of asking you to rate a particular caregiver that we call out, because we're recognizing that that's really the most effective way to use this tool, and it's the way that you're going to have the most information and be able to make the most accurate descriptions and decisions about the kids that you're serving by really understanding each caregiver as their own entity. This gives us a bit more deep dive into that as we think about why do we include the multiple caregiver. Again, different people have different strengths and needs, and it's okay to recognize that. It's okay to consider areas in which the needs of one caregiver either make better or potentially make worse the needs of another caregiver, and the strengths do the same thing. Again, I mentioned earlier, we're not going to dive deep into the algorithm, but we do recognize that caregivers play an important role in identifying the acuity ratings through that algorithm system. So by rating each of the caregivers individually, it allows that algorithm system to really do its work more effectively by pulling the information that it needs from each of the caregivers as is appropriate. Again, rating couples allows opportunity to mask the needs, and we don't want to mask needs. We want to understand what needs are so that we can come up with a good plan of action to help families overcome those needs. Great. So we are reaching a point now where let's pause for a moment and ask some questions specific to this. I am going to move on into foster care and some congregated residential care type discussions in a few minutes. So if you have questions on those, we'll wait on those. But let's get into what questions we may have right now. Like I said, I can't see them. So Megan, are you there? Do you have anything you want to share?
Hi, Josh. I don't see anything yet, but if you want to give a few minutes for questions to be entered.
Sure. So we'll do the awkward 30-second pause here. If you have any questions on what we've discussed so far or something you want me to dig deeper in, now's a great time to type that into the chat box.
I do have a hand raised, but it doesn't appear that their microphone is connected. It's Barbara Bonholm. Okay, and we do have some questions coming through, so I'll start reading those to you, Josh.
Yeah, go for it.
Okay, so the first one is, what makes someone a caregiver? If a child is in foster care and the birth parent is incarcerated or has never had any contact with a child, would the child be rated alongside the foster parent? Those were two separate questions.
Two separate questions. Okay, so for the for the foster care piece, I will say we will dig into that very, very shortly because I have a slide coming up talking about what are the different kind of foster care scenarios. The sneak preview on that will be that it has a lot to do with what the permanency plan for the child is. And I recognize that not everybody on the call may really have much experience working with permanency plans. So essentially, that is going to be what is the sort of legal plan for the future of this child's care. In many foster care scenarios, the permanency plan, as determined either by a CPS or a judge or kind of someone involved in the system in that regard, the permanency plan is often going to be returned to parent, returned to the biological parent. Not always, and we'll get into what some of the other scenarios are, but typically that's probably going to be the most common permanency plan we see. In that scenario, we do want to rate that parent that they are intended, parent or parents that they are intended to return to. We're also going to rate their foster parents, and we'll get into that a bit in a minute. The parent who's incarcerated, there can be different scenarios for that. Maybe that parent is going to be released, or we anticipate a release that would then allow them to have the child return to their home, and so we would still consider rating them. And we can get in a bit to that in a minute when we dive deeper into that topic. As far as what makes someone a caregiver, that I think really gets back to the question about asking the child and asking the folks who are identified early on to us as being the caregiver. Anyone who is providing care to that child in the context of not as a professional caregiver other than foster parents, but as a member of that child's family can be considered a caregiver given the understanding of their sort of legal guardian or legal caregiver, kind of giving us that understanding that yes, this person is a significant caregiver in this child's life, or the child themselves giving us that indication. So I hope that answers that question. Are there others?
Yes, we have quite a few now, so I'll move on to the next one. If a child is in foster care and the birth parent, that's that one, sorry, I had the wrong one highlighted. What if there is a person in the home who is providing care to a child but does not want to identify themselves that way and does not want to be rated on the can?
Sure. So, one easy example of that can often be like a live-in girl or boyfriend of the sort of legal parent that might be in that home. We see those scenarios a lot where there may be, a non-biologically related adult who's living in that home either as a boyfriend or girlfriend, or maybe for another reason, even as, just renting a spare room or something like that. And I think you see those scenarios a lot. And something that I would really encourage you as care managers to think about in that regard is that adult playing a significant role in the life of the child, and in particular, are they having an impact upon the development of that child? And if the child and or the other caregiver or that adult themselves sort of identify that yes, they play some amount of role like that, then we might want to really consider rating them. And it can be understandable that there can be an emotional component to this, right? As a live-in boy or girlfriend, I might not feel comfortable calling myself that title, calling myself caregiver, or maybe that child's actual parent feels very uncomfortable giving me that title. And there can be pieces to navigate through that conversation. And that's really where our role as care managers becomes so critical, is to help these adults understand when we say caregiver, we are not necessarily attaching any bias or any judgment to like what caregiver means in terms of the emotional connection in a family, but we really want to be diving into who are the adults that are having a genuine impact upon the development of this child through his or her life, and help them to look at and try to recognize how their actions might be impacting that child, and why it might be really important for us to understand how their impact can be helping or potentially hurting a child's development. It requires a lot of nuance on your part to really be thinking about what is the right way to have this conversation, with whom to start the conversation, and who your allies in that conversation might be that can help to talk to that person or talk to those multiple people to really recognize what their role in the child's life might be. But certainly in scenarios like that, it is totally acceptable for us and really important for us to be rating that adult and recognizing the role that they're playing in the child's life and how that's an important context in that child's journey through our system.
Okay,
What do we have
next
next?
question. Oh, this question, they weren't sure if it was a health home or a CAMS question, but they were saying, for instance, a mom's boyfriend moves in, would this justify a new CAMS?
So I'm not going to dive too deep into specific health home policy around this because that's not necessarily my role here. But we do, I would call folks' attention to the fact that there are policies in place and sort of guidance from the state around when it is appropriate to do a modification and to do a new CANS based on a significant change that could be impacting a child's life. My guidance on that would be to really consider and to speak with your supervisor about what those individual scenarios are, because I can certainly see scenarios where a significant change in the caregiving could be having a significant impact upon the child's needs and strengths, and vice versa. A scenario where maybe it's not having a huge impact, and we would simply move on to reassessing on the normal time frame. So I realize that I'm hedging a bit here, but I don't want to dive too deep down that rabbit hole because we're sort of not here to discuss that topic. But if you want to reach out to us after this webinar, we can certainly have more specific conversations about individual scenarios you're facing and try to help you through that.
Perfect. I was going to say to refer to the CAMS guidance for significant life events as well.
Yeah.
So moving on, a child in foster care may have a parent that has visitation, or the parent may not actually participate in the visitation. If we do not have communication with the biological parent, this makes it difficult to rate as a caregiver. What do you suggest?
So these are definitely tricky scenarios. One thing that I always want to remind people of, and that we really try to hammer home through all your training around the CANS, is that it's a communimetric tool. It's meant to bring in the understandings that a wide variety of people have around the needs and strengths of a child and their caregivers. Ideally, we want to have connection to that caregiver, and it really, should be a part of your role as care managers to do your best to make that connection and to understand that person and allow them to give us, their understanding of themselves. But we also recognize that isn't always possible, and some of the caregivers may not sort of give us that attention or be willing to speak with us in that way. And so that's where the CANS being a communimetric tool becomes so important, because we may not know that person or have direct contact, but we know people who do, right? We know other caregivers, other adults in that child's life who can give us some insight into that adult and what their needs or strengths may be. We know potentially other professionals that have worked with that adult and worked with the family and have an understanding of those needs. And it becomes really critical to do our best to rate those caregivers. Any of us that have worked with children who have visitations can certainly recognize that 1 hour spent with that parent with whom they get an hour a week of visitation can often have more of an impact upon that child's functioning and how that week or month is going for that child than all the rest of the time they spend with the other caregivers, be they foster parents or in a residential setting or whatever, right? That can be a critical hour to the functioning of that child. And conversely, missing that appointment for whatever reason can often have a significant, really be the most significant event in that child's week and have a significant impact upon their functioning, throughout the rest of their life. And so we really want to try to understand what are the needs and strengths of that caregiver and what can that be meaning to the child that we're serving. So it can be tricky. There's no 100% this is the way to do it answer to this, but it is really important for us to try to really develop our understanding of who that person is and what their impact can be upon the child that we're serving. Other questions? Are we good
Oh,
on
sorry.
questions?
Yep, I unmuted. What are the maximum amount of caregivers that can be rated in the cans?
You might be able to answer if there's a cap on the UAS. I don't necessarily have that access myself, so I don't know if there's a specific limit that the technology puts on us. As far as the guidance around the assessment tool, you know, from Chapin Hall and the way that it's taught, we don't necessarily put a cap on it. So from our perspective, we would really want that to be a decision based on the individual needs of the child and the family. What I can't speak to is if there's any technological limitations on that.
I just asked Heather, so I should have a follow-up question answer for that.
Cool.
Would babysitters be rated as caregivers as well?
So in this scenario, we would not necessarily consider babysitters to be caregivers, really, because they are a professional, they are a service that is being provided. I know that this can get a little sticky because we could look at foster care as a service, but it really does kind of fit into its own kind of separate category that we're going to talk about in a minute. So in general, we would not necessarily look at babysitters as being caregivers, but when I say not necessarily, there can be scenarios where that might be right, and the family might really consider that to be the right choice given on the impact that they're having on a child. So I would not 100% say no, but I think it would really be a discussion you would want to be having with your supervisor, you know, amongst your team, and maybe even really trying to understand more about who this person is in the life of the child and what they really mean to that family before you make a final decision on that.
And this is the last question I see, and it ties back to the visitation question. They asked, so they should rate a parent regardless of contact with their child that is in foster care.
So I'm not going to 100% say yes or no. There's a few things that you want to consider, and it's probably a good time to kind of start thinking about this next slide that we're going to get into, which is what is the permanency goal? And I'll dig into this, and this is probably a good time to just kind of move forward, and then if there's more questions, we can get to them in a few minutes. So what you see here, again, this comes from your manual. You all have access to this. This presentation in particular will be posted on our website soon, so you'll be able to pull up this slide if you want. But if you have access to the CANS manual, which you all do, and I can give you insight onto where to find it, then you have access to this chart. So as we think about kids in foster care, we want to really be thinking about what is the permanency goal for that child. And for the sake of this page, as I talk about foster care, we can also consider residential care, which is listed as congregate care down here. We can talk a bit about what that looks like. So if the plan is reunification, and I worked with foster care youth for many years prior to this in my career, and I recognize that oftentimes the written permanency plan is oftentimes very unrealistic from the perspective of family, from the perspective of the professionals that work with the families. And there are often times where many of the people that are working with a child don't necessarily agree with the permanency goal. But we want to recognize that permanency plans are legal documents, and we want to be working from the understanding that if the permanency plan says they're going to reunify with family, we really want to treat the scenario as that is being true until something changes, which moves us to one of these other categories. So in those scenarios where maybe there is a scheduled weekly or monthly visitation with a parent, and for whatever reason the parent is not engaging or the child is not engaging, and those visitations are not happening, and everyone is really feeling that this adult is no longer having a big impact upon the child's life, that may be true, but we also want to recognize that the plan still is reunification. And as I mentioned earlier, even the absence of those visits can still be having a real strong impact upon the child on a daily, a weekly, a monthly, an hourly basis. So in scenarios where we have a child in foster care and the plan is reunification, we want to rate the parents, the parents that we are planning to reunify with, and the foster parents. So this could be 4 or more people. It could be 2 biological parents, and it could be 2 foster parents, and it might necessitate rating 4 individuals, each of whom is having an impact and a different impact upon this child's life. One of those biological parents might be the one that we sort of anticipate the child is going to return to, and the other we may think is going to have no connection. But until that is really stated to us in a documented way, we are going to act as if the child is going to be parented by both of those parents again when they are reunified. And so we want to look at it from that regard. Similarly, there may be a permanency goal to live with a relative. So we recognize that they are not going to return to the biological parents, but they may be living with a biological relative or some type of relative. In those scenarios, they're still in foster care. The plan is to go live with relatives. So again, we're going to rate the relative or relatives. We're going to rate the foster parents in that scenario. Where we move into a different plan is when we get to adoption. In the case of adoption, when we consider a child to be pre-adoptive, that really means that the rights of the parents have been terminated at this point. And if for whatever reason and in whatever way, the rights of the parents are no longer present, we don't see any scenario in which the child goes back to live with those parents. So in that scenario, we will no longer rate the biological family because there's no plan now to return. Instead, we are going to look at who are the pre-adoptive parents. Sometimes the pre-adoptive parents are also the foster parents. The child may currently live with the foster parents who are going to adopt them or are planning to adopt them. In other cases, that may not be the case. We may have identified pre-adoptive parents, but the child does not yet live with them and currently lives with other foster parents. Sometimes there may be a scenario where the child is freed for adoption and they are living with foster parents who will not be adopting them, but we haven't identified yet pre-adoptive parents. So in that scenario, we're rating those foster parents and not anyone else because we haven't identified the pre-adoptive parent yet. So those scenarios can present a few different options for us. There's also, for those of you not real familiar with the foster care process, something which we kind of refer to as APLA, which is another planned arrangement. And this is sort of our catch-all category for other scenarios that could be happening. The most common of which is often that the child simply becomes a legal adult, or for whatever reason, there is no plan to adopt the child at current. And so in those scenarios, when they're in foster care, we're going to rate the foster parents. We can still rate their parents. If there have been scenarios where a child's plan is for another planned arrangement, maybe the plan is for them to live independently, but temporarily they are living with a parent or another biological relative, but that is not sort of their permanency plan. In those scenarios, you would rate, whatever those caregivers are that they're living with. That kind of takes us to our next category, which is congregate care. Think about different types of residential or group home living. That's what we're talking about here. Again, if the plan is reunification, we're going to rate the parents. Notice here that there's no mention of foster parents. In congregate care scenarios, we do not look at the staff of those settings as being caregivers for the sake of rating them on the cans. This is really critical for you to understand because foster parents, we do. They are living in that individual's home. That individual is really acting as a parent to them until the scenario changes. But in a congregate care setting, the staff changes. There are shifts, people come and go, move on with their careers, new staff are hired. We don't rate those people. We treat them as professional service providers and not as anyone that's going to be rated within the cans. So in a reunification scenario, we're rating parents. In a scenario where the plan is to go back to live with relatives after the congregate care state is over, we would rate those relatives. In an adoption scenario, if there are pre-adoptive parents identified, but the child is currently in that residential setting, we're going to rate those pre-adoptive parents. If they are not identified and there is no identified pre-adoptive parent for this child, then we are simply going to continue to rate no caregiver. In an APLA scenario, we would rate no caregiver. The rules are very, very similar here for a child who is living independently. If they are living independently, but there is a plan to return to the parents, that's how we're going to rate them. If the plan is to go live with relatives, but they're currently living independently, we rate those relatives. If there's a pre-adoptive parent identified, we rate them, otherwise no. In an Annapolis scenario, which typically would mean that child's going to continue to live independently, we do not rate a caregiver. Again, we're not diving into the algorithm today, but I know the question often comes up. There are scenarios built into the algorithm to account for children who do not have any identified caregiver. And again, I'm not going to dive deep into that, but it has a lot to do with the self-care management item, which is in the transition to adulthood module for those children. And it allows sort of the same decision-making process that the algorithm uses the caregiver sections for to continue, but take advantage of ratings of that child's ability to manage their own care in their own environment, since they don't have a caregiver providing support. So let's dive a little bit deeper into foster parents. There are some unique things to consider here. There's a lot of you on this call. I'll bet a lot of you have some pretty significant experience working with foster parents, and I'll bet a lot of you don't. And foster parents really do present unique challenges, unique strengths, and some unique considerations that we want to give to them as we're really thinking about what are the strengths and needs that foster parents bring to the table. So a few things that we want to think about. The first of which is many of the foster parents that may be serving the children that you are serving bring to the table lots of experience, lots of strengths. Many of them have hosted dozens of children in their homes, may have adopted many of those children, or continue to have an impact upon the lives of many of those children, even as they've moved into adulthood. But one of the things that's really important for us to remember, and this is certainly transferable to other types of parents, but I think it's critical to think about when we think about foster parents, is the idea that strengths don't always mean an absence of needs. That I can have real strong strengths in an area and really be able to do something well, but still have needs in that area and still sometimes need action, right? As we think about the cans, we're always rating in terms of action. They're not judgments about the folks that we're serving, but they are determining, do they need some help? Do they need some type of action that we as care managers can play a role in helping to put in place for them? So some of the ways to think about this, and this is based on a true story of a family that I served many years ago in a prior role. This particular foster parent was kind of a legend in the foster parenting community, had hosted dozens, if not hundreds, of children in their home throughout a long foster care career, was really very experienced, had many teens with kind of significant trauma histories in the home, and was very skilled at managing that and working through some really challenging behaviors, what many other parents would consider very challenging behaviors, and was really quite good. Had a home that was like a Swiss watch. Everything ran on time, could get 6 kids to 6 different appointments and still have time to cook dinner. It was an impressive sight to see. One thing, though, that had not been true for this particular person was that she had not had any of her own biological children in her life. And up until this point, and she was in her early 60s, up until this point in her career, had never hosted a child in diapers. And she was kind of begged by her supporting organization to please take on a child who at that time was 4 months old. Had entered into foster care, and the organization was really struggling to find a solid placement for this child. And she agreed to take on a child as well as a few older siblings, but the one child in particular that was only a few months old came into her home, and it presented to her a huge organizational challenge. Again, this caregiver was exceptionally strong in organization. It would probably be the #1 strength, that's the centerpiece strength of this caregiver's life. However, she had simply never really had experience with taking care of a child in diapers and taking care of the unique needs presented by this child. She didn't have a good organizational structure. Any of you who are parents, can probably attest to that you didn't have this either when you first had your child. I know I didn't. It took us, my spouse and I, a long time to really organize what our lives would look like, and remembering to take diapers everywhere we go and have a change of clothes and have this and have that. And it presented a huge organizational organizational challenge to this foster parent. So while she was extremely strong, the context had changed for her. The child that came into her home presented a new need that she had never experienced before. So her organization, which under most scenarios was a 0, with regard to her ability to care for this child, really became a 3. She needed immediate and kind of extensive training and support and help to get herself up to speed. And once she was, that rating changed quite dramatically. But in the early stages of her work with this child, who ended up being in her home for 4 years, she needed significant support around the area of organization, as well as a few others. But I want to give you this idea of how strengths can still be needs, and needs can still be strengths. And we want to recognize that some of these needs can be very situational, very context-driven, and very unique to foster parents. In most cases, those people who become parents the traditional way, the biological way, have time to prepare for that, have time to read some books and get their diapers and have everything ready to go. Foster parents sometimes don't have that opportunity, and they can be asked to take on a child on very short notice, and that prevents very significant needs. So that's something I want you to all be thinking about as we consider foster parents and rating them, because it can often be very easy to look at foster parents and really be enamored with how strong they are and want to just say they're going to be 0s down the line. My gosh, look at how they have everything together. But really, the needs of being a caregiver to foster children can be very different than the needs of a more traditional type of parent. Other things that can have an impact on this, think about the age of foster parents. I mentioned in that scenario, we were talking about a woman in her early 60s who then cared for that child through and up until about that child's 5th birthday. In some scenarios, the age of the foster parent versus the age of the child can prevent a number of challenges, either in understanding culture and understanding what the needs of children may be. It can also just prevent straight up physical challenges that children at that age need to be carried, need to be picked up, need to be held, need to be cuddled, need to be played with, and some caregivers may or may not be able to meet those needs effectively. We also want to consider there can be a number of different cultural stresses that can impact the needs of caregivers in a foster parent scenario. One of the common ones that you see a lot in foster parenting is cultural clashes around religion. Some foster parents may have very strong religious ties, but the families of the children in foster care may have very different connections to their spirituality and may be very opposed to, for instance, a child attending the same church as the foster parent belongs to, and that can create real culture stress within that family unit. And can present challenges that need to be overcome. If those challenges are actionable, then we look to rate those for action as we think about. So again, we wouldn't necessarily say that there's a lack of strength for that foster parent, but we would recognize that there may be a challenge, there may be an actionable need around, for instance, cultural differences within a family, because there are now cultural differences within that family unit that didn't exist before this particular foster child came into their life. So we want to be considering what can that look like, and what can those real actionable needs be. And when I say action, it could be maybe organizing, we have our CAFTA services, we have our HCBS services that have come online. It may be organizing service during that 2-hour window where the foster parent is at a church service, and we are helping a service to be provided to the child so that they can be having some of their needs met during that same window of time elsewhere, right? So we're thinking about, what does that action look like? How are we supporting that action from our role as care managers? Another thing you want to think about really is sort of a lack of control that a foster parent may be feeling, and what are some of the items within the caregiver strengths and needs domain that might be impacted by a lack of control. Foster parents often have very little sort of official right to discuss school plans for their children or have an impact upon school plans. Think about IEP processes, CSE processes. Many foster parents come with a lot of experience, either professionally or through their parenting and foster parenting experience, and they really want to have a significant role in that decision-making process for a child. But a school district may say, no, you don't actually have a legal right. We only want to speak with the biological parent. And so that can create certain types of parenting stress, that can create certain actionable needs around care and treatment involvement for those caregivers, and those are really very unique scenarios that impact foster parents that other types of caregivers may not have to navigate because they sort of have more legal rights. The same can be true for various medical decisions that might be made on behalf of the child. Foster parents often have limited rights to make medical decisions for children, and often it's only related to kind of emergency type of care, but any sort of long-term care those decisions tend to be reverted, or not reverted, but at least stay with the biological parents or the permanency plan, whomever they may be. And so foster parents can often feel kind of disenfranchised in those decision-making processes. And that can have an impact upon some of their actionable needs within that caregiver domain. So as we think about this a little bit deeper, here's a few other items that I just kind of pulled, and a lot of this is from my own experience thinking about foster parents and what are some of the items that we really want to be thinking about and how we might look at it just slightly differently for a foster parent versus for other types of caregivers. Self-care, daily living. Foster parents at times really might have a significant change in their own self-care and daily living needs based on a foster child that enters their life. The example I gave earlier of the woman that took upon a very needy 4-month-old into her home, one of the challenges that she faced early on was even feeling like she couldn't take a shower, that she couldn't take 20 minutes to bathe and to kind of do that type of very simple self-care for herself, because she felt that the child needed 24/7 eyes-on support, and that she didn't feel comfortable kind of doing that part of her life while having to care for the child, and didn't necessarily have another adult that could take over in that scenario. So it had an impact upon her self-care and daily living. You may see foster parents who give up some other types of self-care in order to meet the needs of their children. You'll see foster parents, maybe a foster parent who attends a weekly yoga class at noon on Wednesdays, but they've taken upon a foster child who's currently suspended or not allowed to attend school and is therefore home during the day. And now that adult who had a very healthy self-care behavior and attending that yoga class every week can no longer go to that yoga class and hasn't been able to find a substitution. So they have a need there now, something that was a very healthy behavior for them. They're no longer able to engage in because of this unique scenario that is created by being a foster parent. So things to think about there. Organization, I mentioned earlier, I don't need to dive a lot deeper into that, but taking a child into your home at various different ages with various different needs can dramatically change your organizational needs within your home. And you can be very good at organization, but simply not be able to manage the particular needs that are being presented to you. Often, we've talked a lot about visitations. Often kids have very unique visitation schedules, and foster parents don't have a lot of power over that. So if they take a foster child on and that foster child needs to visit with their parent every Tuesday at 4:30 p.m., then that's when it needs to be done, and the foster parent has to meet that need. Sometimes they can, sometimes they need help, and if they need help, that's action. That's potentially an actionable rating there. Supervision, most of you should be pretty experienced with rating this item, so we don't need to dig real deep into it. Parenting stress is a real big one, and for me, one of the keys that helps me to really lock in on is this parent experiencing stress is the respite request. And if you've worked with foster parents in a scenario where respite is an option, you've probably had many of these conversations where you'll receive requests from foster parents saying, can this child do 1 or 2 nights overnight with a respite caregiver once a month? That's what I need in order to reset myself emotionally. It's what I need in order to go see a movie with my spouse once a month. It's what I need to get some shopping done because I feel like this child's needs sort of inhibit my ability to go get the weekly or monthly shopping done. When they're talking to us about that they really would benefit from the respite service, they're talking to us about having a parenting stress need, and they're sort of telling us what is the action that they think is necessary in order for them to overcome that and continue to make positive impacts upon this child's life. So they're identifying parenting stress. They might be identifying other actionable needs as well, but we want to be thinking about, just because they're really strong at this, just because they've had 30 foster care kids in their home over a 20-year career, doesn't mean they might not be experiencing new stresses that they didn't have before. So we really want to be looking at this item and recognizing it's not about judging them and saying, oh my gosh, you're so stressed. It's about recognizing you have enough stress that you're asking for some action. You're telling us that you sort of know how to relieve your stress, but you need that help. Help is action. That's what we're rating for. And informal supports. Oftentimes, caregivers get a ton of support from their informal support network, their family and their friends, when they become foster parents, but sometimes they don't. Sometimes that same network of helpers that was so willing to jump in and be a babysitter and be a support and be all the things that parents need, they were willing to do that for the biological family, but they are not willing to do that for foster care. It's an unfortunate truth that is the case sometimes for foster parents. They don't get the same support from that support network that they've had before when they choose to become foster parents. And we may need to recognize that and really try to recognize that in some cases they might need to develop a new support network. And there's lots of great support networks out there of foster parents who support each other and former foster parents who are willing to provide certain levels of support to the current foster parents. There's a lot of really great setups out there, but that's going to be action that we're going to take to try to help make those connections, and we want to be rating for that. So 6 minutes left. I don't mind going over, but I know I want to be honest to what the schedule was. I'm just going to kind of close real quickly with a few things by saying on the screen you will see some names and some email addresses. Mine is in the top left. I'm the Western Region lead for the CANS Institute. You'll notice Dr. Susie Button, who's our Institute Director. She couldn't be on the call today, but you see her information there, as well as my colleagues in the other regions. Brandon Howlett in the Capital Region. Mary Nichols is in the Hudson Valley. Cynthia Schemelty is downstate in New York and Long Island. We also have a network of coaches that are members of all of our teams. We are all always ready and willing to talk with you about any of your CANS related questions, and that includes helping folks through the assessment, which we know is always tough, but it more importantly includes answering some questions like have been posed today and really talking to you about some specific situations you may be facing and unique questions you may have, and really trying to help you overcome that. And when we don't know the answer, we'll help you connect to the people who do know the answer. It can also be us coming out to your sites and meeting with your teams and attending a staff meeting and talking through some of your challenging cases and talking through some of the concepts which we know can be challenging within CANS and the TCOM structure. So don't be afraid to reach out to us and tell us what you need to help you. You're also going to receive a survey at the end of this, and one of the things we're going to ask is, A, did you like this? Was this helpful to you? And B, what are some other topics that we can cover for these lunch and learns? And we want to try to really narrow in on some specific topics and try to help you guys, and maybe do this monthly. And some of my colleagues, Brandon and Cynthia and Mary, may be able to lead some of these and help you with the topics that they're real experts in. We want to make this available to you and be a resource to you guys. So, and you'll also see down below there's the address for our website in general, which is probably where we're going to post this this recording when we're done. So if you want to share it with colleagues, you can do it that way. So with that, what other questions do we have? I know there were more foster care related and residential related potentially questions. Let's ask them. What have we got?
Okay. They just started coming in. So the first one is, in a foster care situation, do we rate the foster parent as a primary caregiver and the birth parent as a secondary caregiver?
As far as I know, and Megan, feel free to correct me because I'm not a UAS expert, the primary versus the secondary has no impact impact upon how we look at the CANs from the scope of who are the caregivers or the way the algorithm looks at the CANs in order to pull that information. So I don't necessarily know if there's particular guidance around who should be listed as primary or secondary, and I don't know. Megan, do you have any other information on that?
I don't believe so either, but I will follow up with Heather. She's our CANs expert.
Okay, cool. So maybe if we can get that answer, maybe we can even email it back out to this group to let you know. But to my knowledge, there's no real impact upon whichever order those go in. But that's only to my knowledge. There may be other things that I'm not aware of.
And someone asked, will this be emailed as well?
The recording, is that what we're referring to?
They didn't specify. I think they mean the slides and the recording, which will both be available.
Yeah, they'll both be available. I think we're going to put them on that kansnewyorkinstitute.org. I don't know if it'll be emailable. I know oftentimes kind of anything with audio recordings gets caught up in a lot of folks' spam and various firewalls. So I don't know if that'll be the venue through which this is sent out. But I think at the very least, I think we can email and remind folks where this can be found once it's up.
And how does the caregiver rating affect the acuity score for the child? For example, if one parent has more needs, 2s and 3s, and the second parent has 0s and 1s?
Sure. So ultimately, the algorithm is looking to identify needs, right? And it's I'm not going to dive deep into what the algorithm is, and obviously it's different for the different ages, and there's some nuances to it. But the algorithm is looking for those 2s and those 3s, those actionable needs items, and depending on sort of what the ultimate decision the algorithm makes on acuity, it's going to be based on a number of factors, and we're not going to dive deep into that. But that's why it becomes critical to rate all caregivers, because some may be caregivers that are sort of identifying as having a lot of strengths, mostly 0s and 1s, and others may be caregivers that are showing a lot of need, and there are actionable areas where we need to jump into that. So the algorithm is going to sort of find those actionable needs that apply to it. And one thing to kind of remember is within the caregiver strengths and needs domain, not every single item on there is pulled into the algorithm. There are many items within that domain, but not all. So that's something for you to think about. And we're not going to review that today. But if it finds actionable needs within those particular items that are called out, then that is going to sort of trigger the yes or the no for that particular part of the algorithm, and and allow the process to continue. So again, it sort of reiterates, rate every caregiver, because the different and unique needs and strengths of each caregiver are going to have an impact upon the ultimate decision that the algorithm makes.
Okay, I don't see any more questions coming through. I don't know if you want to give a few more minutes or just end it now since it's 1.
Nice. I mean, if you've got time, I'm happy to sit around if for a few more minutes if anyone is actively typing. But otherwise, I'm super impressed that we actually nailed this at 1 o'clock.
Yeah, I don't see anything else coming through. So if they have questions, they can email the BML, or they can reach out to Josh. But I think ending at 1 sounds good.
Awesome. Yeah, so you can all be expecting an email pretty soon that will include the survey. Please fill it out. If you liked me, great. If you hated this, that's great for us to know too, because we're trying to come up with ways to serve you all better and to be a resource to you. So we want to know what are the best ways for us to do that. So please be honest and share some feedback with us. We'll really appreciate it.
All right. Thanks, guys. Thanks, Josh, for hosting.
Yeah, thank you all.
Great. Bye.